the note circulated. Am I right in that?
Yeah.
You are, yes.
That's good. So I just really wanted to add a few other bits to that of other things that I've been involved in, because I thought they might be of interest to you. I'm going to start sort of in slightly, it might not be chronological order, but I would start with yesterday. And so yesterday, myself and a number of officers, some of whom are in this room as well, attended the Inequalities Summit, which was held at Bath College. And this looked at, obviously, national inequality, but also focusing on local inequality and the various different factors that contribute to that. And I just really wanted to alert you to the fact that certainly I and officers, I said, in this room, left with feeling that we should now grasp this and move on with something to address inequality, because some of the councillors that have been here for longest, and also some of the, are you a lay member of this, Chris? Who have been involved in children's services for a really long time, will be aware that inequalities has been an issue that has troubled many of us for a really long time. So I think it is a great opportunity. So I wanted to first of all tell you about that. And then secondly, another event I attended was a skills summit, round table event, which was led by the Road Haulage Association. But I think what was of particular interest was how the impact of fewer people choosing to go into that business, what the impact that was having then on all the other businesses, including, of course, our local services such as passenger transport. So, how we get our children to and from school each day, for example. So I think there are some opportunities that will arise from that as well. So I just wanted to let you know of those things. I think there was something else I was going to mention, Mary, and I have now forgotten what it was. Of course, yes. Yeah. So, and also last week, myself and Mary, I'm not sure if anyone else here was there too, we went to Youth Connect Southwest's annual celebration event, and it was absolutely heartwarming. It was so wonderful to see children and young people who have had perhaps not always the best start in life or the best sort of life chances, faced with all sorts of different issues throughout their young lives already, being acknowledged and rewarded and awarded awards for their achievements, because they had been recognised by those people who are both within Youth Connect Southwest and also those associated organisations there too. So again, another thing I thought would be worthy of note for you all.
Thank you, Dina. Any questions for Dina? Liz?
Yes, thank you very much for your report, which came well in advance. We had plenty of time to read it. I might be touching on things that may not pertain to this meeting, but regarding the budget, and as the lead member for children and young people, we've all been, well, many of us have been at these webinars where we've been told, we're going to have to cut resources, there's going to be less money coming in. I did ask the question, because a huge amount of money is going to children and young people, will that be safeguarded, will that be cut? And obviously I got a very full answer saying, well, we're not sure at the moment, but we're going to try and protect as much as we can. In the reports that we've read for this meeting, loud and clear, there are statements stating that there are not enough resources. So are we going to see the budget increase? Are you able to let us know this information, but can we put it on record that there are areas within our remit that are in very great need of more resources, and there is a worry that these will not be met, and therefore in some of the reports, our statutory duties can't be met. So I don't know if you can say anything about this, but I thought it's worth, stating it now.
Thank you, Liz. And I think it is a really important point to raise, and it does trouble me that we are in this situation. We, I'm sure you will have seen within the report and also in the two webinars that have been held already that a lot of that pressure that is coming into children's services is for things that are very much outside of our control. So those, more children coming into care, more children who we have a duty to through the unaccounted asylum-seeking children schemes, as well as other in-year and unforeseen reasons as well, such as, and it's within our remit about, say, passenger transport, so for example, that we've seen the costs associated with that have massively increased, and that couldn't have been, we couldn't have seen that, a year ago. So it's, but what I will assure you of is that I will do everything I can to make sure that our absolutely vital services are protected, and that will be my priority, is making sure that our, most vulnerable are not, the services for those are not cut in any way.
Kevin.
Thank you. A couple of questions, please, if I may. I think that most teaching unions, at least, are saying that it's the time of crisis now. And we've been told by many of the multi-academy trusts in BAMES that they have made representations to the Confederation of School Trusts, to the government. Is the local authority part of this push to ensure that cuts are not carried out?
Well, certainly we've been having discussions with our various MAT leaders across the board around the impact of, rising costs, including energy costs, and I'll pass over to Chris in a moment just to give you an absolute reassurance on that, because I know that in other places in the country that there is a huge worry about that ability to pay those bills as they're coming up. I know also that our MATs are also looking at how they can look to the future. So the Midsummer Norton Partnership has a programme across many of its schools now, retrofitting PVs and other energy saving measures, and we continue to lobby government where we see things are being unfair or unjust. I know that I have very recently, I think yesterday, signed off a letter to one of the many previous education ministers, to Michael Govson, but that is on a different matter. That is around the refugee crisis as well. And yes, we continue to write to ministers on a variety of issues. So, Chris, can you pick up the energy piece?
Thank you. I think Dean has given a really good summary of all the activity we've been involved in with our schools recently to kind of make sure that we reflect and mirror the efforts of our leaders in education with central government in lobbying for more funding. There are increasing costs that many schools face in relation to into many things. The rising cost of living, the energy bills, and also problems with finding recruitment. And next week at School Standards Board, we've got an agenda item on finance on its own, just to have a look at actually what have we done separately, what can we do collectively to make sure that we highlight the difficulties that our schools are facing, which Kevin quite rightly has pointed out.
Kevin?
Sorry.
Yeah, carry on.
Yeah, do you mind if I... Thank you, Vic. In the report, you mentioned about the early years, looks like training, new opportunities for training. And I just wondered that whether this is coming with further funding and whether the early years, they've said anything about early years investment into, investment from the government into early years, because we keep hearing time and time again about the dire cuts that are happening and there's nothing through for early years at all. And not only is this going to compound the pandemic effect, and primary schools will soon be getting and receiving, which they are at this moment in time, those children who have lost out on the early years investment and are becoming even further down the track.
I'm going to just ask Chris just to pick up that point about early years funding, if I may. But one thing I did want to stress is a lot of funding, such as for early years, is not for statutory services, and I think it is really difficult when we are at a point in time like we are now, because I think we would all agree that funding in early years is absolutely fundamental, as a preventative service, and we need to find perhaps creative ways of making sure that the funding is where it needs to be, because we currently have this appalling situation where we are funding basically firefighting measures, and we need to be at the same time being able to refocus funding at this level, at this end as well, so that in future we don't then have to have the firefighting measures. But I'm sure you can appreciate that is a real challenge. But I'll ask Chris to pick up in more detail.
Thank you, Dina. I have to confess I don't know the exact detail of this funded announcement at the moment. What I do know is it's not an investment in the, if you like, the funding rate per child. So what it does look like is additional investment in training and support for those staff, which is always welcomed and is needed in relation to them supporting the cohort of children. What I'm fairly certain is not is an increase in the funding rate per child that nurseries, I think you agree, are looking for in order to remain viable in what is an increasingly competitive. Yes, it's a similar sector in relation to the problems that schools are having recruiting teaching assistants, and that actually there are numerous other, if you like, employment opportunities now which do offer financially a better reward than that, and that is the challenge in the early years. But I can certainly find out a lot more detail around that particular funded tranche, including what it means for Baines, and provide that through to Mark through the minutes.
Fine, thank you. Paul.
Dina, thank you for your report. Can I just raise a couple of queries? The reference to Youth Connect, you remember the previous administration set up a mutual venture for that to go out, and you've quite nicely said it's gone from strength to strength. Could we at some stage have a report back about what it's doing and how it's performing? Because I think it was a big decision to do it, if you remember, Chair. And, if it is being positive, the question that follows on from that, are there any other areas of, if you like, discretionary spend which we could set free by a similar process as an authority? So I think that was my first question, and I'm sure you would just say yes.
Of course I'd just say yes, but what I would ask is, would you like that report to come sort of straight from the horse's mouth, as it were, so we can always invite perhaps Tracy Pike and Sam Plummer to attend. I don't know if you can command them in the same way you can command me to attend, but you could ask.
I think I would prefer it to be an officer report about an organisation which is now in effect independent of the authority, and whether it and how it's providing those services.
Yeah, we can certainly do that. And I think one of the things that has been proven by kind of setting our youth services free, as it were, is that they have done what they said they could do, which is not just offer targeted work, as they would have been limited to do if they had remained within the council, but have been able to access additional funding so they can offer in certain places, universal services as well. And it was their 3rd year anniversary too, so they've been around for some time.
And I mean, the thing was we used mutual ventures to set them up and do it properly, and it does show, I think, about how you can actually do something. It doesn't always have to be in our direct control, but it's good if that is the case. But I think it'd be nice to have a professional report on that. The second question...
So just to be clear then, Paul, you're asking for that report. Can that report come by way of your cabinet member update next time? So you integrate it into that?
Yes, of course, yes.
Because what I'm very concerned about is agenda setting, and we have so much challenge to what we can get onto the agenda, so that I don't want to lightly introduce...
No, I understand what you're saying, Chair,
Yeah.
but and which is the reason I said don't bring them along, because they'll do a selling job, and that isn't what we're talking about. I'm talking about
I'll
just
put a meaty paragraph in my report.
Thank you.
So that
Excellent, thank
this
you.
doesn't become,
Carry on, Paul.
doesn't
the
become
other
a
one was
two-day
about
event.
the SEND review. I mean, Liz has quite rightly made mention around funding and everything, and SEND is still one of the key issues for us as an authority, the pressures on SEND, and we're not the only local authority that's having that problem. And I mean, is there any indication, you know, we're talking about a financial report from the government later on, that this may be something that gets ditched along with, if you like, some of the adult services. But bearing in mind the service we're talking about, children's services and adult services, are a significant part of our expenditure as an authority, and it does affect the most vulnerable in our community. Is there any indication the government are going to actually help out or not? Because it's absolutely crucial to the young people that we're interested in.
I'm going to pass that over to Mary, because I would probably give you a slightly political answer.
Thank you. So our latest indication is that the government will respond to both the care review and the SEND review and the education white paper mid-December. We have no indication contrary to that, Councillor May, at the moment, but we're at the will of the changes within the government, but that's the most recent indication we had from the DFE, that the government will respond. Of course, in terms of the care review is recommending a 5-year programme and an investment of 2.6 billion to deliver on the care review. They didn't actually put a value on the SEND review. I'm not sure. We've heard some pulling back in terms of the adults, in terms of adult social care, but I guess we'll get a sense next week whether that commitment has remained for children. But publicly, the DFE are saying the government are committed to responding to those recommendations by mid-December.
So I thank Dina for not making it political, but I mean, there is an issue here, the politics around this. It's at risk of adversely affecting so many young people, and it's whether this committee should, actual fact, do something to say that we support those young people, because it's easy sitting the other side of the finance table saying children's services are overspending. It's not so good when you're sat that side of the table and you're trying to do the best you can for young people. And it does strike me that there's been a fundamental financial issue from government towards young people.
Right.
I agree with you, Paul.
I can see you wanting to agree, but we are at the mercy of government. They're working on it at the moment, and we don't know what that's to be. I don't know if what you're trying to do is direct government on how they're going to operate. We're receptive of what the government put there. I don't know how much influence that we can put on this, because this is a national problem, not us locally. It's how it interprets locally that affects us, certainly.
I agree with you, Chair. All I'm saying is if we just sit there and complain afterwards, it just strikes me that there is some sense in us actually arguing the case for the communities that we represent.
And you see, Dina, if you can persuade me then.
I wasn't going to try and persuade you of anything, Vic, but what I was going to suggest is that we could write to the ministers and copy our two MPs in as well to outline the case, to say, why it is locally that we actually need this to be resolved positively. and I think that's possibly all we can do at the moment. Obviously, our two MPs, neither of whom are in positions of official influence within government. So I think that's probably what we can, possibly the best we can do. But obviously, I will take every opportunity, as I do, to raise this at the various different places and meetings that I attend to, whether or not that's South West Councils or the LGA.
Right, I will be guided by the panel itself. Is that an approach that the panel would prefer to say, that we want to put it on record that we are concerned about the funding levels directed to children's services, and hope that that's taken into account when they're just informed? So we write with that in mind. That seems to have unanimous support. Right, yeah, fine, thank you. So that's what we'll do on that.
Okay, so if I write that letter and do I copy you in as chair?
Yes, please.
Okay.
Okay. Kevin, I interrupted you. I've got you, Ruth. Kevin, I interrupted you.
Sorry,
You had a further question.
just one last comment, question really. It was around staffing crisis situation, particularly support staff. Not only the difficulty of funding their current pay award, which they rightly deserve, and they should get more anyway, that's another issue, but actually the shortage of being able to recruit any support staff, particularly in special schools or for SEND support and things like that. And at one group of the Southwest meeting I was at last week, they were suggesting that it looks like Oxford local authority is going ahead with some bank staff for support TA staff in schools. They already do it for their care side of things, and they felt it was also appropriate to try and start doing that initiative as well. So I just wondered if that to throw in the pot in your discussions. I don't know whether that's going to help or not, but as recruitment and retention become more and more of an issue and Lidl's becomes more attractive, that might just be another issue that is floating out there.
Thank you.
Or how they're doing it.
Yeah, thank you, Karen. And as I'm sure you can appreciate, obviously, as all bar, I think 7 of our schools are now within MATs, the sort of day-to-day staffing issues, I'm certainly not as, as I say with. I was just wondering if Chris had any insights to share.
Yeah, we have talked about how we support TAs, and it is, as Dina said, the majority of the employees are no longer the local authority within the school, but actually it's within our interest, because quite a lot of the teaching assistant posts are funded from high needs funding, which comes from the local authority schools to support children with SEND. So it's very much in our interest. And myself and Suzanne Westhead, who is the Adult Services Director, attend a schools forum, which is part of Bath College and links in with a number of organisations in Baines, looking at where we've got challenges around staffing recruitment. So we've just been working on a piece in the early years. So we've been trying to support the early years sector with their recruitment issues. And again, that's 120 odd different employers, and it's a real challenge. But we've been trying to do things like supporting them with skill fairs, making sure that the training offer from Bath College is easily accessible. What can we do to promote their vacancies? And we have talked about what we can do to look at the issues in teacher recruitment. And one of the issues is because we've got quite a fragmented is the wrong word, because I don't say that in a negative word, because we've got quite a mixed economy in relation to schools and employers. Or they are all coming at it in different ways. So you might find that some schools are offering better salaries than others, or there's different recruitment approaches, and fundamentally you tend to be chasing the same pool of people, and then that creates a problem. So we do know about the Oxford approach, and I know that Suzanne's been looking at the bank similar model here in Baines, and that's been done through the support of someone who's been brought in specifically for the local authority to look at where we've got recruitment issues, both in the LA, but where we're reliant on Ryan Partners. And Olwyn Donnelly, who's the head of education commissioner who works for me, is looking just at that, Kevin, in relation to that. Is there room in the LA or outside of the LA to be develop some sort of bank approach to TAs? So we've got a group of people who can be flexible and move around to support needs. So we're in the early stages of that, but we picked up on the Oxford model quite early. And it's Olwyn's working with his trying to work with our HR consultant, who's been brought in specifically to look at the skills shortages to see what that might mean for us.
Okay, Ruth, you've been very patient.
Right. Thank you. Yeah, thanks for the report. I just wanted to say about when it comes to kind of lobbying and so on, I agree, Dina, good idea to also do that through the local government association, because we're all facing similar problems. But also just to add on to the recruitment and retention of staff problem, and in particular support staff, I think you kindly wrote an email to one of my residents in Weston who is concerned about the homeschool transport for children with special educational needs, and so just to sort of flag that up again to say, it isn't only the teaching, is it? It's also all of these people who have an important role, and that she's quite concerned about safety and safeguarding issues. I think if there's too much of a turnover and the staff aren't, perhaps fully, aware of the difficulties. Anyway, thank you.
Right, okay, Joanna.
I have a completely separate point that I would like to ask you to look into. I'm aware that national government has said to universities, and as we have too in the city, that unless students on completing the course have got a job of a certain amount of money within a certain amount of time, then those courses can no longer be run at those universities, and those universities have to cut those courses, which is going to have a significant impact upon lots of different types of teaching in this city. And I just wondered if you could inquire into this and bring the issue back to us so that we could have a look at that issue.
Okay. I think that brings that to a close at the moment. Thank you very much, Dina. We've given you a few little duties to perform. So if we can move on then to item 9, and this is the Bain Swindon Wiltshire Integrated Care Board. And if I can invite Laura Ambley, the Place Director, please, to address the panel. Laura.
Morning, Chair. Thank you, and good morning all. I've provided an update report for you this time, which I will assume you've all had and assume is read. But if I may, just pull out some headlines for you. At your last panel in particular, I know Councillor Wright and others spoke very passionately about dental services, and I think you requested specifically that our update included that. So we have started the report with that. It outlines the factual position, which essentially is that Bain, Swindon and Wiltshire ICB has got the delegated responsibility for commissioning primary services and GP contracts, as we know. From April 2023, that will include pharmaceutical, ophthalmic and dental services. And you can see there at the moment that dental service contracts, there's about 126 in our locality. So I think, as we acknowledged last time, that's a significant challenge. And to support this transition, there's a new commissioning hub called the South West Collaborative Commissioning Hub. That will be responsible for the day-to-day operational support. It will be in place for a 2-year period, and we will draw on support from existing NHS England commissioners. Now, we had to complete, as Bain, Swindon and Wiltshire Integrated Care Board, a pre-delegation assessment to determine our readiness to assure that responsibility. So that was signed off by the moderation panel, and their recommendation will go to the NHS England National Board on the 1st of December, so we'll update you on that. Now, there'll be a delegated steering group, and that will include Integrated Care Board colleagues, primary care, etc., as set out in the report. So really making sure that we have that strong oversight on this moving forward. And then finally in the report, just so that we don't forget really, it's why we're doing this and remembering the benefits for local people and the outcomes. So as we sort of rehearsed last time, if you like, it is improved care quality. It is about acknowledging and trying to reduce those health inequalities, improving prevention, and I know particularly we were concerned about our children and young people, and the improved use of resources and clinical leadership to try and lead at place in this space. So that was the update that I had for you on that request. But there are a number of other things in the report, Chair. So if I may, I could just pull out a few more headlines, unless you want.
Please.
Okay. So St Martin's Ward 4, this is a temporary community ward that has been put in place to relieve pressure on our acute hospitals. We heard last time the real challenges there. And there's 23 beds for people who no longer require urgent care but do need things such as therapeutic support, reablement and care packages, etc. And I have to say, I'm really pleased that this is up and running, operational. Early indications are it's been really successful, and your partners that have been working together at this locality have been really exemplary. So RUH, Royal United Hospital Bath, HCRG in particular, who are leading that community service, obviously working with the local authority, and indeed Integrated Care Board and partners. So I think that's a good news story, and we keep a watching brief on that one. The report touches on the Integrated Care Partnership. I won't re-rehearse that. We spoke last time, a reminder that they set the Integrated Care Strategy, and just to let you know, they met at the end of October. I think for this panel, focusing on children and young people, the next item around the Barnardo's Health Equality Collaboration bid is a really important one. This has gone through our Children and Young People Board at BSWICB, and Mary and I obviously have both been cited on that and in support of it. Essentially, the bid is to try and get some support from Barnardo's and other professionals to set up a framework, crucially with support of the young people themselves, so that we have the young person's voice in the room, but also our voluntary and community sector. And that will help us with that framework to inform and direct our resources, to take evidence-based action so we can see what actually works. And it's looking at a programme of support for 3 years. So again, we'll keep the panel updated on the outcome of that bid. Another piece of good news, I think, is Polton X-ray facilities. So the donation from the Friends of Polton Hospital League of Friends has actually donated for the machine itself, and with NHS funding, the building work to accommodate the machine. So that's due to open in spring 2023, and clearly that will have huge implications and be really positive in terms of being able to direct people there. And then virtual wards. So I think we are all aware, and we heard from RUH colleagues last time, that there is a virtual ward model currently existing and operational in Baines locality. What we're looking to do is actually build on that to try and do more about admission avoidance. So the current model looks at trying to enable people out of hospital, but they are already in hospital. This one is trying to, if you like, avoid their admission in the first instance and see what wraparound support we can provide. So that's new funding, and we're developing that model across Baines, Swindon and Wiltshire. But obviously in Baines, we're looking to build on our existing model that we already have, which has been really successful. And then finally, Chair, just to finish on the COVID and flu vaccinations, it wouldn't be a health update if I didn't give that plug. And I think we are doing well, but there is more to do. There's only 44% uptake locally of those that are eligible for the COVID vaccination. And obviously there are a range of venues there, and Bath Racecourse, etc. And again, with flu, I think, again, it's promoting it at every opportunity, particularly low uptake with those with learning disabilities. So again, another watching brief I think we need to give on that. So I'll pause there, Chair, in case there's any questions on the update.
Panel members, yes, please.
Thank you very much for that very informative report. I did wonder about the virtual ward and how it could possibly operate, in that would it not be very intensive on resources if you have a group of people, even if they're remote, focusing in on one particular patient? I just wonder, how does it actually work? If I'm doing feedback on this and say, well, there's going to be a virtual ward situation, they would say, well, what is it? How does it operate? So if you could give me a little bit more detail. Thank you.
Yeah, I mean, obviously, as we are all aware from the update we had from RUH last time, we've got significant pressure in our acute hospitals. And as we know, we're trying to promote home is best and doing everything possible to prevent admissions. So that's the concept of the scheme, really. You're right, it will require resourcing. What we're looking to do is actually blend resourcing alongside existing programmes. So there's something about how people are referred into the virtual ward in the first instance. If we can prevent them from having a hospital conveyance through ambulance and then through the emergency department, If instead we could have referrals through GPs or through our care coordination centre, then that in itself is already reducing resources at one end of the system that we know is significantly under pressure. In terms of what happens once they are, if you like, admitted into the virtual ward, they will be under clinical leadership, and that will be determined as appropriate. There will be community provision, so whether that's community nurses, district nursing, etc. So again, that will be blended with existing resources. For the most part, of course, there will need to be additional capacity, particularly in community. But you already have the hospital at home team that are based in the RUH. We're looking to expand on that, and then, as I say, put additional resource in the community.
So you've got staff actually going in. The individual patients don't feel isolated and remote from receiving any procedure.
They're all under clinical leadership, so they would have to be determined that they're appropriate in the first instance for being virtual ward. There's technology that can assist in virtual monitoring of them, and everybody has a single point of contact, a single phone number, so if there were any concerns, they would be able to contact that. And the agreed package of whatever they need would be agreed on their basis of being in the virtual ward.
Patients won't feel denied anything by this approach?
No, and it's intended to be a choice, and it's intended to prevent that admission avoidance and to, you know, promote home is best. Not intended to make anybody feel remote or pressured into doing so. Absolutely not. It's used as and when appropriate.
Fine, thank you. Kevin.
Thank you. Can I just ask, so first of all, I say thank you very much for the new X-ray facilities and the Paul League of Friends, great, and also the good news about St Martin's Ward going up and running. Now I'll launch into the question. I'm always launching into questions without saying the good. I've lost my professional technique there. I do apologise. Can I just ask about the dental service? If I understood it rightly, which I probably haven't, but if I understood it correctly, the big issue around the shortage of dentists was about contracts and money. Are you able, or the ICB able, to change that situation and change the contracts and increase their money?
I'll be honest, I'll have to take that one away and come back to you with what that will mean. I think at the moment we're awaiting to see what those delegated responsibilities look like. So I don't have the answer to that, but I'm happy to take that specific question away and come back if that'd be okay.
Yeah, thank you.
Jo.
Thanks for the report. And yes, picking up on the dental deserts. In the recent event I went to, they talked about how flexible commissioning can... I'm just trying to get my words together. So under legislation in most challenge areas, flexible commissioning can take place. So when you talk about this Southwest Hub, is that flexible commissioning?
Yeah, so the intention of using the Southwest Hub is capacity and capability. It's not intended to remove the flexibility that we're looking for locally. So they still need to respond to those local opportunities, is my understanding. But we can, of course, confirm that. I can ask colleagues in commissioning if they can confirm that for us.
Well, I guess the real issue is, the person in the street needs to go to the dentist and can't find one in Bath. How, through the flexible commissioning, are you being able to create that opportunity for them? That's what we're trying to get to the...
Yeah, understood. And I think, to be honest, this is something that we have to let evolve through that commissioning hub and understand what are going to be the opportunities and how they're going to be able to do that locally. As I say, my understanding is there are currently 126 contracts. I don't know quite what the commissioning framework will look like for that, but the idea is that we have that NHSE support to help us do it. So if I take those questions, Chair, and come back, I appreciate that at the moment, what you've got is a factual update of how, but we haven't got to the what yet.
Okay.
Yeah.
And then taking that a bit further, so one of the, again, going back to the conference I went to, Dentaid, which is a third sector organisation based in the Southampton, go into areas and support local people by literally having a mobile dental bus. In Suffolk, the councillors brought in Dentaid because they realised there was such a problem in the local area. And I'm just wondering, as a group, again, say, let's get in touch with Dentaid and bring them into Bath because there are an awful lot of people who are not getting dental treatment. And even if we do that in the very short term and work out something, could that be a way forward? It was worth sending me to the conference.
Thank you for highlighting that model. I will absolutely pass that on to colleagues and see how we might be able to contact them. Thank you.
Right, Paul, final speaker.
Thank you for a very full report, and it's really nice that the Integrated Care Board is thinking about children. I know in other areas that it's a black hole, and I think it's great that you're actually working with us on that. Can I just raise a couple of things? The voluntary sector, the nature of the HCRG contract is that they're contracting with the voluntary sector. Is there any threat moving forward for the voluntary sector in this area with regards to children?
Well, if I come in and then Mary, you may wish to come in as well. I think what we're looking to make sure that we have is stability, and for me, I think the voluntary sector in this area, we're very lucky, they're very engaged. Yeah. Certainly that's been my observation through the Integrated Care Alliance. I see no reason why that would tail off whatever arrangements we have in place moving forward. So I'm fairly confident on that front. I don't know, Mary, if there's any specifics to pick up.
I would agree. I think we are incredibly fortunate across Bath and North East Somerset that we've an incredibly well-established, mature and very professional set of organisations that are either directly commissioned and or attract additional funds through Children in Need or various other mechanisms that actually act to enhance what the local authority commissions. So we've got really good provision and we would want to hold on to it.
Good, thank you. I'll keep asking the question. The other one was young people in crisis that aren't in the system. I'm aware that there's issues there elsewhere in the country, and I'm just wondering what's happening. They're not necessarily in the mental health system, but all of a sudden they show up in the system, and how we're dealing with that as an organisation.
I'm happy to pick that up. There's quite a lot of work happening across Bain, Swindon, Wiltshire. As Laura has mentioned, there's a Children and Young People Transformation Programme, and the 3 directors of children's services from Bain, Swindon and Wiltshire, along with Laura and other colleagues from the ICS, sit on that group. And very much the areas of priority that have been identified, which are very much linked to our strategic evidence base, but also is around children with mental health. It's our children with SEND, and it's those children with complex health needs. There has been increased funding coming into the system, and actually there's a new role called a key worker role that will be funded by the ICS to help young people with those complex health needs, who may or may not be known to the local authority, but might be known to other services. And so that's new funding, recurrent funding that's coming in. They're not yet in post, but I think what we've been able to do through that CYP transformation is really expose the challenges and the pressures that our children and young people are having, and what, from a health perspective, what more services could be developed. There is also some work happening in Salisbury and in Swindon, some pilots around outreach, assertive outreach around for children with eating disorders. And once those are evaluated, that then will be rolled out across Bath and North East Somerset as well. So there's quite a bit happening. I think colleagues Lucy Baker came and spoke about the mental health probably 2 panels ago now. But it might be timely to invite her to come back to give an update, because those pilots will inform then what's the rollout of provision for us locally.
Thank you. Thank you, Chair.
Okay, so Laura, thank you very much. You brought us some quite encouraging news this time, particularly around the Ward 4 23 beds and the effective work with HCRG and the various agencies in identifying that. And also, it's proved very useful, the dental seminar, because we've been able to, through Joe, we've been able to identify a mobile service that might be something appropriate for the area in the interim. So thank you very much. So if we move on then to item 10, and this is the early years and primary data emerging picture. And if I can ask Chris Wilford to introduce this report, please.
Thank you very much. Thank you, Chair. I hope you've all managed to see and read a copy of the report. What I propose to do is just provide a summary of what the paper's telling us, and then get into any questions that you have, if that's okay. So what we've pulled together for you at the request of the panel, and I think it was back in July that there was a request to start to see education data again. As you know, during the pandemic years, there were no primary assessments or examinations, so no data to look at. And the secondary assessments were teacher-graded assessments, and the DFE requested that we didn't collect that data. So this year's the first year when we've gone back to something that looks like normal business in relation to schools, and the first year that so far we're not being affected by the pandemic in terms of school closures. We would normally come to scrutiny in springtime when we've got full evaluated and validated data, but those requests come earlier. So what we've been able to produce at this point is a look at our early years and our primary assessment data. So as I said, it's provisional data. It's based on an initial release. There will be a revised release of the primary and early years data, which will come out later this year, and that will inform a better picture of what we've seen and what we understand. So what I've tried to avoid is putting too many numbers in this, because I'm very conscious that this could change, and this is a public report, so we need to be really cognizant of that. What I've tried to do is just pull out any themes and patterns that I've observed through the first look at the data. What I will say, though, is whilst there isn't often too much movement once you've got the validated data and revised data, but we do need to be cognizant that it could change. So this is the first set of results since 2019, and I think everybody was wondering what would happen in relation to the educational outcomes following the impact of school closures, following the number of children who are out of school through COVID. And it would be fair to say nationally and across the piece, we have seen a drop in the early years performance in the early years framework and in the Key Stage 1, Key Stage 2 phonics. Nationally, we have seen that across the piece in some of the reports that are coming out at the moment. I guess we perhaps could have expected that in relation to the amount of access that children have had to education and the amount of education that parents have to provide at home, which is a challenge. In Baines, we have seen that as well. We're no different in relation to what we've seen as a national picture, and I guess roughly it's about 10% drop across the piece in that percentage of children achieving as well as they could have. But there are some positives in that in relation to Baines. So in the early years, we have fared fairly well. We have to remember, though, we're not exactly comparing like for like, so the early years framework changed during the pandemic, so the assessment data that is collected in more isn't so much a high tariff assessment, if you like. It's not necessarily used to present any national data, inform anything nationally like it used to be in terms of publishing that data. It's more used to inform children's destinations and to support parents with understanding how well their children do. But it does give us, I think, still a fair indication. So it looks like that although we've had an impact on some of our early years data, it's again slightly better than the national position. And again, yet to be validated, it does look like some of our outcomes in the early years for our population of children on free school meals is slightly improved. So panel will know that in the early years in primary, we have had a persistent attainment gap around particularly our free school meals children. So that's one positive that I can see in the data to date. Again, in Key Stage 1, across reading, writing and maths, we can see that there has been a drop compared to our 2019 performance, and prior to 2019 there had been an increase in level of performance in Baines in those areas. So we've seen a drop there. But as you can see from the paper, it's again in those areas it is slightly above national. I'll come on to some of the groups at the end, and I'll just talk about the groups, but I'll just finish off the key stages. Key Stage 2 is a little more interesting in terms of what it's telling us so far. I think in Key Stage 2, when I talk to my colleagues in the business intelligence team who have the tricky job of validating all this data and looking at what's coming in, we're quite interested in what this is telling us at the moment. So you'll see in the information I've presented that we have fallen back from where we were in 2019, and we need to do some more work once we've got the validated data to understand why that is in in relation to specifically looking at groups of children, looking at groups of schools, so we can understand that position. I don't think I would have expected to see that, would be fair at this stage, but I don't think I could comment in any detail about why we've seen that. So we've also got a lot more work to do. We've got to look at the secondary information, and that data will start to come through in 2020. And as you'll know, that whilst we've had that persistent attainment gap in our early years and primary schools, it generally improves once they get to secondary age and they leave their secondary education. So I'm really interested to see what that tells us when we get that through. I think it'd be fair to say, and I say this with lots of caveats, that I think we have seen that the attainment gap in BAMES in the early years and in the primary for our children with free scale meals has fallen back further again in this year. I can't tell you today what that looks like comparing to that nationally, but they have fared less well than their peers in their education again during the pandemic. And that's something obviously that as a panel you're concerned about, something we're concerned about. But again, we need to look at the data in a bit more detail to understand what that's telling us. I'm particularly interested to see what that looks like we get into secondary. For SEND children, what's a little interesting in relation to the data and what's it telling us so far in the early years, but more so in primary, whilst their performance has declined in line with their peers, it doesn't appear to have fallen any further back. So it looks like some of our SENS children's results in their education at that level have held up reasonably well throughout the pandemic, which is positive. Anecdotally, what I'm being told by some of my colleagues and in the multi-academy trusts is they're very happy with some of the outcomes of children with SEND in Key Stage 4. So it'll be really interesting when we get that data to see how well that's fared up. So our SEND data has always been roughly in line with national, but it has had some decline in Key Stage 4 over previous years. So I'll be interested to see that's held up. And the other thing that I pulled out in looking at the Key Stage 2 data for now is for some time girls have outperformed boys in relation to their education in reading, writing and maths, and particularly in Key Stage 1 and through into Key Stage 2. But in Key Stage 2 at the moment that seems to have fallen back some way, which again is quite interesting because it seems to remain quite strong at Key Stage 1. So again, I'm interested in the validated data when we look at Key Stage 2 to find out a bit more what that tells us. Whilst I say it's fallen back, they're still outperforming boys in Key Stage 2 in those subjects, so it's not like it's fallen behind boys' performance. And then just a couple of final points. Obviously, in BAMES, we no longer, if you like, run the majority of schools in BAMES. They're run across a number of organisations, multi-academy trusts, single academy trusts, who don't report to the local authority, but they do report to the regional director's office. But just to reassure Scrutiny that the local authorities remains absolutely committed to all the outcomes of children in their education. There are children still. What the challenge is we have to work quite differently now across these partnerships, and we have to be work quite differently how we form our relationships. And I'm pleased to say that the relationship that we still have with our trust leaders is really positive. So next Tuesday we've got the first school standards board of this year, and I'll be presenting a similar presentation, perhaps talk a little bit more detail, closed doors, about what some of the data might say, just to get a real sense and some feedback about what the trust is telling us, what they're talking about, particularly around Key Stage 2. And then as I understand it, the emerging process through this new education world we're entering and post-white paper is that there will be an area development plan which is formulated between the local authority, the regional director's office and the multi-academy trust, and that should be populated with the priorities for the year based on what information and data is telling us. So there'll be an opportunity to discuss some of the performance flow through the regional director's office. And I had another discussion with regional director's office as well about coming back here to panel to present some more information about their work with academy trusts and their oversight of those trusts, which they've agreed to do. We're a little bit unsure about exactly the pathway for the white paper. As Mary said, we're due to hear comment back on it in December, but I believe it should have been further through Parliament now than it is. I think there might be some difficulties, but once we invite our colleagues back from the Regional Director's Office, we can ask for a further update. So I'll close my bit out there and offer up to questions.
Thank you, Chris. Liz.
Thank you, Chris. I think you have almost answered most of my questions, but the first one was how can we believe the invalidated comparative data? How sure can we be of that? And I think you hinted possibly not totally sure about that, but it gives an indication, basically. So
Well,
have I answered my question myself for you?
Yeah.
Yes.
I mean, the data comes in through the DFE and it's collected through LGA Inform and it's given to us. So in terms of its accuracy, it's as accurate as that is. But we have to remember that then there is a period when schools will review papers, exam marks, things like that, and then it goes back in and then it's looked at others.
Thank you. My second question is, I mean, I think we all expected, I mean, and nationally it's been proved as well as here in Baines, that there's going to be a drop in outcomes for children because of COVID. But it's interesting to note that although Key Stage 2 looks like some really good progress has been made, what you said in your report is there's a big difference between the outcomes for children in Key Stage 1 and 2. And I think you hinted that, again, you're not really sure why this is. So I think I've answered that as well for you, I think.
You have. Before I hypothesise on that one, I really would like to see the validated data for Key Stage 2. As I said, at the moment, it surprises me and the data analysts a little bit.
Right. And my final point is that I think we feel very frustrated as members of this panel that because of the multi-academy trust, I'm not making a political point here, can I just say, but because of these trusts, the steerage of education is in Baines is really out of our control. We just have to rely on the multi-academy trusts and the regional standards board. The director, I think, has got a new name now. We're dependent on them telling you and telling our Baines officers what's happening. And there's this very important meeting on Tuesday. We've heard it mentioned twice. So I just wondered, yes, we want the Regional Standards Board to personnel to come and talk to us, but yes, we want more information. I'm sure I'm not speaking just for myself. We would like more information. What are they doing? And can we as a council, can we as a panel do anything to encourage what's happening and encourage greater participation, if you like, on behalf of Baines Council and more information for us? So I'm not sure if I've just been very general about this.
No.
But if it could be built in that we get an updated report.
Yep,
Okay,
that's no problem. And I guess just a couple of comments really. I'm sure, like our colleagues from the Regional Director's Office, I'm sure at School Standards Board next week, we can ask one of the chief execs to come along and just give you a real flavour and sense of, you know, what's happening in their trust, what their priorities are, and they're working across. Whilst it's, I guess, there's the feeling that there needs to be more transparency, I think there still is a willingness to cooperate and participate, so we can certainly look at that.
Okay, Paul.
Chair, I wanted to thank you and your Vice Chair, making sure that we've got these meetings where we can concentrate on children's services. And a lot of the worry that I had in the past about not actually getting the reports about this, I think it's great that we've got this report today in a certain amount of detail. And within the recommendations, Chair, quite clearly there's issues that you feel that you should be doing further work to report back. And I think as a committee we should be supporting Chris in doing that because I think it is important. And also picking up Mary's point and the Cabinet member, early intervention in terms of children's services is really good, but it's also important that the early years, and in particular around SEND, I think is a worry for me reading this report about how do we actually engage more effectively around that, because schools may not be dealing with that in the way that perhaps we would be wanting in support of those young people. So I think if in your further reports, when you bring it back, Chris, it'd be really good if you can pick up the SEND, working with Mary on that, because I think it's a key issue from our point of view, because if we identify within the categories of SEND particularly the SEMH element, the more we can do in the early years to if you like, prevent that, if that's the right way of putting it, the more that's going to help the community moving forward. So I think that would be what I would like to see moving forward. But I do think this is a big step forward from my point of view of actually understanding how education is performing. So a big thank you, Chair, for you and the Vice Chair.
Right, thank you. Kevin.
Thank you. Chris, the St John's Foundation, I don't know how far their initial project with the 7 primary schools has got underway. And if it has got underway, were there any differences in performance in Key Stage 1, Key Stage 2?
So they're just come to the end of their first year in the Primary Empowerment Project, which is the project that we worked with St John's to set up, which is working with the 7 schools with the greatest proportion of children in free school meals, but also the attainment gap. So if we just come to the full end of their year, I've deliberately not looked at those 7 schools in a particular fashion in relation to those yet. I probably will at some point. There is an evaluation framework as part of the Primary Empowerment Programme, which was set up by the St John's, and of course some of it is interested in those attainment education outcomes, but it also has a number of other outcomes they're evaluating. They appointed an independent evaluator to look at that project, so that report is due to be presented soon. In fact, myself and Mary were due to meet with St John's this afternoon to start to look at some of that. Unfortunately, they've had to cancel that, so I won't answer that fully to say this is what the impact has been yet, because it's not my project and there is a separate evaluation process for that. I wouldn't expect to see enormous impact in the first year in relation to the St John's. We have to remember that also within that first year, the project would still be set up, the staff would be appointed and the support was being put in place. So I think we need to allow that to happen and then impact on some of those children's outcome. St John's would say, if they were here, that they're in it for the long term. So I think we need to take a long-term view with it.
Yeah, I mean, I was also sort of thinking that a lot of their work, which is also involving around the family and other issues as well, which obviously is vital, and we know that. But the ground keeps shifting, and with the current cost of living crisis, there are more and more families adding to that situation, sadly. And there are a lot of things that are probably working against what they're doing, and it'd be interesting to see how they may be counteracting that, whether it's more resources or other things. So we look forward to hearing a bit more about that. Thank you.
I think probably at I was due to attend the Equality Summit yesterday afternoon, which I think they probably gave more data, but one of my schools got a call from Ofsted, so I was up at a school. But Mary and Dina might want to comment.
Yeah, if I can just add, yesterday St John's did present in terms of the programme, and they're due to have an initial evaluation in January 23. But they also spoke about their absolute commitment that this is a long-term programme and it'll be over a number of years, and their absolute commitment to that cohort and 0 to 12s. So yeah, we were very impressed yesterday in terms of their commitment and what more they want to do in terms of that early years. So we look forward to seeing their report, and I'm sure we'd be happy to share that post-January. Thank you.
Okay, so Ruth, please.
Thank you. Yes, thank you for the report. And in a way, I'm thinking the question is, what can we as a local authority do to help, or as individuals to help improve these attainment levels of the children? And perhaps in a way that might be something else that, I don't know, to give them more work, St John's Foundation perhaps already looking at the role of volunteers in supporting children on a one-to-one basis. And I know that's not that straightforward, and in the past I've helped in my daughter's school with reading, but I was a parent, so even bringing in people who maybe don't have a particular connection with the school in the first place may present some difficulties, but I think there must be a way around that, and giving them training to some extent and support, which would then in turn take off some of the pressure for the teachers, and also help with the families, as has been pointed out, there'd be more families encountering all kinds of difficulties. And so basically, I was just going to ask, is there a way of, does the council have a role either on its own or more likely in partnership with St John's or other charities to encourage people to come forward and help support these children on an individual basis?
Yeah, and there have been a number of initiatives over the years that where volunteers have got involved. I can't remember, was it Study Bugs, which was one which was running Baines, where that was a funded programme to bring in volunteers to go in and support children's reading in school, which is absolutely vital in relation to those. That responsibility around the attainment gap progress in schools is absolutely everybody's responsibility, and I think the part of the meeting yesterday was about how do we bring everyone in relation to addressing some of these issues, and I think there is an absolute need to look at what can we do with our communities, how can the community be involved in supporting the outcomes of those children. So we've got another project which is just starting called the Improving Educational Outcomes for Disadvantaged Pupils, which is a programme the local authority developed in relation to taking a strategic look at what has happened in Baines, because I think one of the things we've never understood is why do we have this attainment gap, particularly at primary and thing. We can hypothesise lots, but I don't think any of us could, in that elevator pitch in a room, nail it in terms of understanding why. So what we've done is a phase programme with St John's, where the LA's funding some and St John's has put some funding in to look at actually how do we understand this gap, what does schools and teachers understand about this gap, and that phase one of the programme started this academic year, and it'll last for the next 6 to 8 months, and there's a group of leads from all the multi-academy trusts involved in the development of that hypothesis, and it's been led by the Big Education Trust. We're meeting with them Friday. But going into phase two, it's about exploring with schools and with partners about what's working well in Baines and what can we build on and what we need to do. And we've certainly talked with the Big Education Trust about what can we do with parents and what can we do with volunteers to support that work. So I think that's a really valid point.
Kevin, final speaker.
Thank you. Just wondered, Chris, if you could comment the next report when you've done with all the validated data, if there is anything that people have commented on the National Tutoring Programme and how that may have affected or otherwise outcomes in schools, and also whether now the government has put speech and language therapists on the shortage list for occupations, whether again there is an issue there that has been found in schools, because I know that anecdotally there is an issue around that and finding those support for early years.
Yeah, I don't know if we'll be able to granulate the data into the impact. Well, certainly the business intelligence team, I don't think they'll be able to granulate the data to look at the impact of the National Tutoring Programme. In some ways, I think that's probably the best left to the government. But what I can do is take a view locally on what they think of the impact is. I can think of some good things, which is funding has been used for. I can think of some other things that perhaps have been said about the National Tutoring Programme. But I can certainly ask the question about how it's used. I certainly ask my schools how it's been used and how they've managed to draw upon it. So we can provide that, but it'll be more accurate more anecdotal as opposed to data-driven. That's okay. Speech and language has been a local challenge. I think our local SALT team is now fully staffed. But it has been a challenge and will be again in the future. It is a shortage.
Okay then, so if we can take the 3 recommendations as printed, and we look forward to a future report from you, Chris, and in that future report, if you can identify progress on seeking voluntary assistance, we've got to be trying, it's evident we have to be quite innovative in how we move forward, so it's just another consideration. And I realise that there are challenges around voluntary assistance, which was identified to me on our pre-meeting, so I'm well versed with that. But I think it's something that we do need to explore. So does that meet with the approval of the panel? Right, fine, thank you very much. And so if we can move on, as printed, with just that little additional bits to emphasise on voluntary assistance. So if we move on to item 11, the music service, and again, Chris, it's down to you.
Thank you. Just let my colleagues. So first of all, I'd like to introduce my colleague to my right, who's actually author of the paper.
Simon Locke. I lead the music services for North Somerset and South Gloucestershire, and I've recently been working to support Staines Music Service as well.
Great, so we'll do a bit of a double act with mainly Simon talking through to the report for myself, but I'll just do an introduction to the paper.
So can I just ask again, I didn't catch your name, please.
Simon Locke.
Simon Locke, right. So Simon, you're overseeing this merger of North Somerset, ourselves, South Gloucestershire?
Yes.
This is what's set up in January of this year?
Yes, this is the proposal that was brought to the panel back in January.
Yeah.
And the update to the paper which we're bringing to you today builds on the paper back in January, updates on changes from DFE and how that influences the future direction for the music services.
Fine, thank you. Please carry on. Sorry, is that interruption?
Yeah, so I mean, Simon has just mentioned that we've been through some changes in the music service over the last couple of years, and I can remember some papers we bought previously when we were online and we weren't in person. We talked about some of the challenges that the service and where it was back in 2019. It had some fairly poor performance outcomes. It was being looked at by the Arts Council in England, and we'd put an improvement plan in place. And then we have gone through a process of trying to put the service back onto a bit more of a stable footing, if you like, and what the Arts Council has been keen and is now starting to formulate in policy is the wider footprints for music services. So we'll talk about that in a little while. So we also came back with a paper to say that we're doing some work with North Somerset and South Gloucestershire about working alongside them. Really pleased to say that I think that's gone really well. I think it's been a real benefit for us and for North Somerset and South Gloucestershire. Some of the Baines music staff are now supporting and working in those areas and vice versa. So there's been some real benefits to that collaboration. And our data, which we have to return to Arts Council England, is on the up, which is really positive. And we have a much more, we have a better relationship, I think, with Arts Council England for the work that we're doing going forward, which I think is really important. So we'd been on a trajectory where we've been thinking about actually how do we formalise this relationship. We need to make sure that everyone's got the right roles and responsibilities within the organisation, but also need to make sure that we're fit and ready for the future, for whatever that brings, and importantly able to deliver on the Arts Council's plan. Back in July last year, some of that has had to change. Some of our thinking has had to change. There is emerging quite a clear policy shift from the DFE in relation to music services, which has kind of got two prongs on it. So one is less of them in relation to the number of organisations that deliver a music hub and, if you like, distribute the funding to deliver the music education plan in each local authority. And the second, if you like, theme, which is emerging, is actually it's very much around. We are going to make everyone enter into a competitive process for the bid for their Arts Council funding. So it's grant money we receive. Music service is not a statutory function, but if you take on the Arts Council's funding, you are responsible for delivering the music education plan, but it doesn't have to be a local authority. So there are some clear messages coming that when that bidding process opens, that they will be actively looking at independent organisations who perhaps can do different things that local authority can't, fundraise, be charitable status, do those things to deliver that plan. And that, I guess crudely, the Arts Council doesn't want to see its funding being used to pay the salaries of teachers in local authorities anymore. I think is probably a fair reflection of it. So That's coming out. I attended an LGA webinar with the DFE. It was fascinating. They had multi-academy trusts presenting on that webinar, and then after that we saw an announcement that actually they were encouraging multi-academy trusts to bid for the Arts Council funding to deliver the music services. So we are going through a definite policy shift about what happens locally. Simon does his best to hang on to the coattails of all that work, of what's changing, and run the three services and support the three services on a day-to-day basis. So we have had to shift our thinking quite rapidly to think about how do we position ourselves, and there is a real willingness in North Somerset and South Gloucester to do this as well. How do we position ourselves to be ready and fit for the future? And I think I'll stop there and hand over to Simon, who might praise the paper a bit better than I have.
Thanks, Chris. Yes, I think Chris summarises those key changes for us very succinctly. Up until last January, the proposals that we brought to in January were built on how do we create a merged music service that is going through that process of becoming more efficient, sharing skills, sharing resources, and building a bigger, better, more universal offer for our music service. The DFE changes, the funding we have at the moment, we've been receiving since 2012, and that was to deliver the current National Plan for Music Education. That's the government's vision for young people's music. As Chris said, in July 22, we received the first draft of the National Plan 2, the refresh version, and we expect that to come into force in September 2023. As with any government public funding, that will therefore be subject to a new round of tendering for that funding. And government are very much looking for a considerable step change towards, as Chris says, independent strategic organisation being the funded organisation, and that strategic organisation, which is largely led up by volunteers in that sort of charity trustee type role, representing the wider view of young people's music. So it's not just our music services traditional view in that sort of formal education based in schools, but it's also about young people's music in the community, an awful lot around SEMH, how and the power of music. In fact, that's the title of the paper, is the power of music, how we can harness that to really improve our outcomes for young people's music in a very broader sense. We know it will be competitive. The briefing that Chris and I attended, of the current 119 funded organisations that receive the grant at the moment, we expect that to reduce to around 40 to 50. On this webinar of those people who might be interested in bidding for the funding, there were over 230 organisations present. So it is going to be highly competitive. What we therefore want to do is propose a model that puts in a very strong bid and makes sure that we can continue to influence young people's music in Baines and our wider area. For me, what this says is actually the moves we were making last year towards a larger footprint of merged services, greater efficiency, a more universal offer. This is matching very much what the FE are talking about now. So I think actually the journey we've been on out of our own choice to make a bigger, better music service for ourselves is very much setting us up to make a very strong bid for future government, and it's fitting the future government's vision. The radical change I think we have to look at, and is the backbone of this proposal, is what is that organisation as a merged service. It no longer looks viable as that merged service sitting within the local authority, so we are proposing that it leaves local authority control, becomes an independent organisation, a registered company limited by guarantee, which will be a charity. That will have that drive, focus on strategically defining where young people's music goes in our region. Alongside that, there will be a traded arm that will continue to deliver our traditional services, making sure there is still instrumental lessons happening in schools as they do now, that there is still a workforce supported to deliver that activity, that we continue to offer our music centres, ensemble activities, events that schools attend. So we are positioning ourselves in a place where we protect local services and make sure that we are fitting with the FE's future vision.
Okay, so I don't know if you noticed, Simon, that when he mentioned it, it's going to be a highly competitive process, the hands went up. So I'm going to call on Rob first, please.
Yeah, thank you. Yeah, I mean, I understand this is focused on, if you like, on the mechanics of a process of forming everything like this, but I can't help but reflecting that in our communities and that there's a rich vein of, whether they're orchestras, bands, ensembles and everything like this. And I suspect maybe a very, very high percentage of those members of those particular groups started because they had the ability to either blow or swipe an instrument in their school years. And I think that connection and that start has started giving them a whole range of other lifestyle attributes, the ability to work with others, in various disciplines and everything like this. So anything I think we can do to support the progress of music into those lower ages must be done, because I mean it just feeds into so many other things. So I would obviously support all of this. The only thing I was going to pick up on the recommendations is that I don't know if 2.1 is actually worded right, because because it's asked to share with Baines and South Gloucester, and I'm wondering whether that's supposed to say with North Somerset and South Gloucester. So whether that just ties that in. Yeah, it's just. I mean, I can understand this is a report possibly gone to the 3 other local authorities and everything like this, but just in terms of accuracy, and that doesn't sort of diminish anything from the actual report, which I would totally support.
So before you answer that, I think we'll take some more questions because it might be on a similar theme. So, Liz.
Okay. Well, we've been through a long journey with the Music Education Service, firstly in Baines and now with this proposed merger. And I remember back some years ago that the Arts Council was very displeased with Baines and the way it was spending the music budget, and something had to happen and something had to give. And then you came in January, I think it was you, Simon, and we were all very enthusiastic about this proposed merger. It looked like it was going to be absolutely fantastic. So now everything's changed again, and my concern is this is going to be taken out of the control of councils, and this tripartite organisation hub will operate apart from our local councils. I'm just wondering about money, and the other concern, which I think Rob has mentioned, and I think many others will probably say this after me, is that it's going to be the bids are going to be very competitive, so there's no way Baines on his own would be able to get a grant. So something's got to happen, so it must be part of this hub, and I would agree, yes, we're going to have this tripartite hub. But if it's so competitive, what happens? This is my first question. I've got a couple others, if that's okay. What happens if the bid is not successful? What will happen to this tripartite music service? And where are you getting all your money from anyway? Okay, first question. The second one is that there are no plans to... the second question, I'll go on to individual musical lessons. There are no plans at the moment. Sorry, I've lost my train of thought. I'll go back to my second question. Sorry. There are no plans to introduce individual musical instrument lessons to children in Baines free of charge. And I had had some research from Bristol that they, through a trust, are able to offer individual music instrument lessons to every child in Bristol schools. I assume it's probably primary schools or something. And is there a way forward for us to cooperate with this or to learn from this? And my third question, which I keep forgetting, and I don't know why, is we are part of a tripartite group. We're nearly Avon, and we're leaving out Bristol. And I remember having this conversation with you. Why isn't Bristol involved with the other 3 authorities? And I think you said Bristol wants to do its own thing. So I just wondered, as Bristol is very successful, it may not want to be part of our hub, but surely it would make this hub even more kind of powerful and able to get and be successful in the competition for bids. It would be a shame for Bristol not to be part of us. Now, I've probably answered the question. They're probably going to say no. But so there are my 3 questions. Thank you.
So if we could pause now for you to cover some of those questions, or all those questions rather, and then we'll continue with the panel's questions.
Shall I do one, two, if I do one? You do 2 and 3? Oh, okay.
So what happens if there's no funding? With the funding comes the obligation to deliver the national plan. So that would become another organisation's responsibility. I think my personal view is disconnecting that from the music service that has the relationships, the workforce. It's not a sensible way forward. That won't be my decision. That would be DFE and Arts Council. We would have to look then at can we make a viable model where our current traded services, which are instrumental lessons in schools, events, music centres, ensemble bands, those sorts of things, we would look for a viable, self-sustaining traded model where that could exist without funding. The wider remit, which is very much what draws on the majority of the funding, that wouldn't be the responsibility of the music service anymore. That would go to the new funded organisation.
So if I can interrupt, there's a big gap between the amount of applicants and those that are likely to be successful. So there's going to be quite a considerable number of failures that would have to take that kind of stance then you're suggesting.
I think those new organisations, Smart Academy Trust, other arts organisations, they would be taking on something new, so they wouldn't be losing anything if they didn't get the funding. So our position is very much that we are the people currently delivering this. We've proven our track record to be able to do it successfully. Therefore, we are the strongest candidates, and therefore we wouldn't need to go through a process of looking at a backup plan. Other organisations coming in and looking to join the competitive bid. This is not existing provision for them, so it would be a neutral outcome if they were unsuccessful.
You seem, with respect, you seem very confident.
We have 3 great music services, and they have a great track record delivering. I have to be confident because I believe in our organisations and I believe what we do. And our bid will be strong, it will be confident if we can get ourselves into this future shape ready to bid.
Right, so if you can continue to answer this questions and Rob.
I think that the model you're describing in Bristol is absolutely something we do as well. We work in partnership with Bristol. They have a new, their terminology is creative director, but it's essentially the role that oversees the music service. We have a new person in post there who I met a few weeks ago. I very much don't see Bristol as a significantly better version of a music service than we're offering. We are very similar, we offer very similar services, and we are very strong. The model that I think you're describing is a program called First Access. It's where we teach whole classes of young people, as you say, very much normally it's in primary school. Every hub, every music service in the country is doing that. That's of those roles that DFE require us to deliver under the national plan. That is core role number 1, and it's our primary focus of our funding. So we do deliver those programmes. I think in the table you'll see it there listed as something which has increased significantly in the number of schools participating in that over the last 12 months, which is great. And as you described, that is absolutely one of those key first touch points where young people get engaged with music. It's like a school lesson, it's not an option, so we're able to really engage with so many young people that then leads on to them choosing to continue with that instrument or engaging music in a different way. So in that context we are delivering a very similar model to Bristol. What's crucial to me is that, having come from a background where I in a former role ran a music service in a unitary authority, it was very different to its neighbours. How you direct your resources, how you spend your money, assign people, is very much led by your demography and what is it that your young people need. And where there is a difference in outcomes and needs of young people, then those resources don't align. And I think what has evolved very organically for us between North Somerset, South Coss and Baines is that the aspirations and the circumstances of our young people are very similar, therefore we're able to coordinate our resources and therefore gain those efficiencies that enable us to do more. And I think we're demonstrating how that similarity of partnerships, equality of partnerships, we don't have a dominant partner in any way, and therefore we are able to genuinely work as three equal organisations delivering. And I think from my conversation with Bristol, they are actually not interested either. Yeah, they are very happy doing their thing. They are very different. They're not a local authority. They are in a trust, the Bristol Music Trust. They are happy where they are. There's another strand of the new plan is around hubs with a specialism in a certain area, and there are two in the country, and Bristol is one of them, that are advancing work around EDI and access for SEND young musicians. That's their focus at the moment. They have their staff. It's not a competitive environment. They are happy doing their thing, and actually, our mergers are very much a merger of like minds. It's the organic way forward.
Okay, Paul.
Sorry, just thinking back, I'm sure not many people can remember Avon County, but the one thing when Avon County was done away with was the fear around the music service, and the discussion in January about pulling together the three. The world has changed, obviously, since January. I mean, is there not now, just twisting Liz's point around slightly, is there now not a case for us to work in partnership with Bristol in submitting a bid? That's my first question. And the second one, we mentioned earlier on about Youth Connect and the value of mutual ventures, setting that up and freeing up from local authorities. And it strikes me that there could be some sense in us looking to see if there's a different model that we could present in a competitive market, where we actually free up the music service to operate outside of those normal areas. And you mentioned around SEND, etc., but we've also got colleges that are quite well advanced around performing arts, and whether we could work in different ways with other organisations. And I think it's actually an opportunity where we could use what you've developed and see whether we could develop it up a bit more in a competitive marketplace.
Absolutely, what the proposals are getting at is we have, similar to Mutual Ventures, we're working with a high growth knowledge company, local equivalent to Mutual Ventures, to develop these plans. They have actually created the initial first business case, which arrived yesterday. I haven't seen it yet. But it's absolutely about making this proposed organisation operate on two levels. One is a very commercial, traded service that can look to fundraise, sponsorship, new avenues, new routes of work that we can grow into. I think absolutely colleges, universities, the wider arts profile is absolutely where we need to be going. Alongside that, there is the charity side that is delivering on the DFE Arts Council outcomes. The briefing that Chris mentioned that we went to was a presentation. Half of that presentation was by Arts Council, showing us the results of some research that they'd undertaken. We were actually part of that in North Somerset, South Gloucestershire, and it was looking at different models of partnership that currently exist between music lead organisations. To come at the Bristol question, Bristol are not looking to come into a formal single entity, and for the reasons I outlined, we're not particularly at the moment approaching that route. But there are other models of partnership that Arts Council are making us aware of. I won't say recommending, that's not what they're doing, but they are making sure that people are aware of different forms of partnership that are happening at the moment. And that includes what they term as an umbrella, and that is that different organisations would come together to make one bid to the DFE, but not come together as a single organisation. So you're travelling a certain way down that line of efficiencies and being able to expand, not nearly as far as we are proposing, because we're making proposals that can really impact in a significant way on people in our three regions. But there is no reason why we couldn't have a conversation, and other authorities are certainly having these conversations as well. Can one of the organisations be the lead bid, and then commission the other organisations to deliver that hub role? there are different levels of ways in which we can work together, and I think there is absolute appetite between ourselves and Bristol and our other neighbours to work together in a loose sense. We do it already, and we will continue to do that. But when it comes to our actual organisation ourselves, we want to make sure that is absolutely focused on outcomes for our young people.
I think we may have to have this conversation again, Chair. If I was sat up in London making this decision, I would look at Bristol and say, why aren't they working together with the three unitary authorities? So it could well be that we have to have this conversation again at some stage in the future. But by pulling the three together, we are actually bigger than Bristol. And under those circumstances, perhaps in making a submission, we should say that we are prepared to, think outside of our box.
Yeah. I think definitely we are putting ourselves in a very strong position, but that is absolutely a premise for a good conversation with Bristol if they are willing.
Right, Kevin.
Yeah, thank you. Just on the, Chris mentioned about sort of anybody can bid, including mats and things. Has your bid, our bid, got the support of mats in Baines and schools in both local authorities? And just as a final bit to that as well, when you're doing the bid up, and I may not be au fait with, you may have said, well, yes, of course, we're already doing this. But with Youth Connect was mentioned by Paul, is the local authority providing that support for the bidding process and giving you a business case, etc.?
The business case we are developing with external consultants as their session, but yes, they are working with the three authorities. We have a board of representatives, which includes Chris, and the equivalent line managers to the three music services across the Alliance. So that is forming the business case and the financial model that we will take forward. It's early days yet. We are waiting for final confirmation from DFE of exactly what the bidding process will be like. And that's the point, I think, at which it's aligning that information alongside the views of yourselves and the equivalent in the other two councils, that we would then be able to go to schools and inform them of our intentions and how they would be part of that bid.
And just picking up the conversation around schools. So on the steering group of the music services we've got representations from schools, and our schools that still work with our music service are supportive of what we're doing. It's a good point actually about a consultation with multi-academy trusts who may be interested locally. My sense is I'm not entirely sure it's landed yet with them. I feel like maybe some of our local MAT leaders have got their hands full with lots of other things to deal with at the moment, and how much interest there would be from smaller local MATs in bidding for that, I don't know, question mark. But on the LGA webinar, it was the national MATs who were presenting, so there may be more interest from some of the larger national multi-academy trusts, is where I guess. But it's a really good point, so I'm going to make a note next week when I meet with the CEOs to have that conversation about the music service, because I haven't done that yet.
Right, so we need to bring this to a close now. So we've got 3 recommendations there. It's contentious about the North Somerset, Baines and South Gloucestershire tripartite agreement and whether it should extend to Bristol. What do the panel feel like this? Are they accepted the recommendation as presented in the paper, or do they want to amend that in any way?
I would propose that we actually say, is there any way of, as Simon mentioned, that actually they could be commissioned or possibly commissioning that service to join the bid as a commissioned service, as you doing a lead bid and Bristol being commissioned for a particular service, or at least to pursue the avenue.
Right. So what you're advocating is a pursuit of trying to get some form of arrangement with Bristol if need be, to experiment with it. Does that meet with the approval of the panel? It does?
Chair, I listened to the answer that we got, but I think the conversation was more like we will work with Bristol rather than trying to formalise that.
Right, okay.
I'm a little bit nervous about pushing that too hard.
Right. Would you like, so in tempering that, would you like to propose some wording? Okay, so that seems a strong point of view there. So we move the recommendations as presented in the paper then. No? What, I mean, I'll have to put this to a vote in the end if it's...
2.1.
To include North Somerset instead
Chair,
of
it was just that the Bain...
Yeah, I've seen that, yeah, okay. Right. Have you got, Mark, have you got that? Can you read that out to us so that there's no...
Well, all that's changed, Chair, is that in the recommendation it says music service, LA share service with Baines and South Gloucestershire. That should say share service with North Somerset and South Gloucestershire.
Right. Right. Now, does that meet with the approval of the panel? Yes? Yes, right. We got there. Thank you. Thank you both, Simon and Chris again. Thank you. So we move on then to item 12, Independent Reviewing Officer Annual Reports. And if I can invite Sarah Hogan to introduce the report. Sarah?
Hi, everybody. You'll have all seen the IRO annual report for 21 to 2022. I think one of the biggest themes that I've tried to convey is I suppose, issues of capacity and demand on the IRO service in Bath and North East Somerset. Perhaps what my report doesn't bring to life is the dual aspect of the officers in those roles as IRO. So they fulfil needs of a service, not just the IRO service. So the structure of the service is that we have independent chairs, so they'll be leading child protection conferences as well as being IROs for children in care. And so when you look at their kind of capacity, we've actually got a full-time equivalent of approximately 3 IROs in Bath and North East Somerset. The end of the year figure, 197 children in care, is therefore those children at the end of the year, so we'll have had other children that have come into care and left care during that period, who will be allocated across the IRO service. So the numbers sometimes can be misleading, I think, in terms of really highlighting the kind of issues around capacity and demand. It's been a really, I would say, challenging 12 months for the IRO service in terms of staffing, and I think just coming out of a pandemic, although we're not entirely out of it, but kind of the ways of working of the last 2.5 years, I think, have been really challenging for carers, particularly for our children and young people, their families, for our colleagues in children's social care. So the IRO service, I think, have had to work incredibly hard to continually maintain really good contact with children in care and to make sure that their needs are continuing to be met and prioritised. So I think I wanted to kind of just start off by saying, the IRO service is really committed to the children in care of Bath and North East Somerset, but at times there are capacity issues which really affect kind of how well the service delivers. I know one of the questions has been around the timeliness in which an IRO sends out the records of a child's review, and that is purely around capacity. An IRO who may work 3 days a week, for 2 of those days might not be even in the county. They might be travelling for kind of 7 hours a day to go and see a child in their placement, meet their carers, see how they're doing, travelling home. So a lot of that timeliness around recording of those reviews is about their capacity to do so. The service, as you'll see, there's been a 9% increase in children in care figures for this year. Again, that's the end of year number, so there will have been a number of children that left care during that period who the IRO service worked with. You'll see as well that in Q4 we had quite an influx of children who came into care, and therefore our kind of numbers of child and care reviews really increased, which meant that we kind of ended the year in a really busy period, and Q1 and Q2 of this year have continued in that trajectory. So it has felt incredibly busy for everybody who's working to support and care for children that are no longer able to live with their families. I think one of the areas that we need to kind of always remain mindful of is the age of the children that are in the care of the local authority. So you'll see kind of 10 plus is the kind of the 2 age groups, 10 to 15 and 16 plus. Those age groups are our largest kind of cohorts of children in care. So if those children remain in care until they're 18, we're looking at kind of, 8 years of an IRO service, children's social care, virtual school, health services, placements, trying to maintain stability and security for those children in an ever-increasing kind of sector that's under a lot of pressure for children in care, as I'm sure those of you have seen in the care review report and some of the challenges that children in care face in terms of placement stability and sufficiency. We've also had a number of children who do have additional needs, complex needs, disabilities, and those children will then obviously go on to be adults who need care and support within the community. So that will put, as that number of children, that cohort increases, then obviously our colleagues in adult social care need to also have the resources in which to respond to the needs of those young people as they become adults. So we kind of, as an IRA service, we have to think really carefully about the transition plans for our children in care. And so that's a really key area of focus for an IRA, particularly for children who come into care perhaps in the later stages of childhood, so kind of 13 plus, and that can include children with disabilities, children who've come from overseas, who are unaccompanied asylum-seeking children. So transition planning is a really key area of focus to think about, well, it's great what's happening now, but what's going to happen when these children are no longer under 18 and in receipt of services from children's services. Obviously, the care leaving team will continue to provide support, but it is very different to kind of what children in care can experience. So unfortunately, I would say because of some of the challenges within the service this year, we haven't been able to progress a really big area for us, which is about obtaining feedback from children in care. I've been here in this post for 4 years, and I've presented to you for kind of 4 years running saying that this is a real challenging area for us. We really kind of want to understand how the children that receive the services from the IRA service, but equally children in care, kind of what their experiences are. But it's really difficult, and it has to be approached really sensitively, because what we hear from children in care is that they want to be children, and they already have a lot of professional involvement, lots of people asking them questions about how they are, how they feel. And I suppose part of the day-to-day role of an IRO is about obtaining the child's wishes and feelings and making sure they're heard, and making sure the people around them are acting on those and taking them into consideration when making decisions. So we've tried over the years numerous kind of strategies to try and find more formal ways of getting feedback that we could then present to others. It kind of shows how we're kind of learning as a service, but as a local authority. But we've not been able to, I suppose, crack that. It's not something that we've kind of forgotten. It's continually talked about between me and IROs in supervision, in team meetings and development days, when we speak to our colleagues in the in-care council, when we speak to colleagues in children's social care. But it's definitely a priority area for the service going forward. We just need to find a forum in which children can give us their feedback so that we can learn from their experiences of what it's like to have an IRA. The IRA service was, however, really instrumental at the end of the previous financial year in supporting the Your Care, Your Say Quorum Voice survey, so Bright Spots, and I'm sure you'll have heard about that, but that was the first time this local authority had used an external provider to help us obtain the wishes and feelings and experiences of the children in the care of Bath and North East Somerset. So it was unfortunate because it was done at a time where we were still in a period of national lockdown, so I think that did impact on the children's participation, but IROs were supporting all those children to complete those surveys. It was a really small number, but what we heard is that nationally it was actually a really good number in comparison to some other local authorities. And so I've been working closely with colleagues in children's social care in terms of kind of the feedback from that survey, and then there's a commitment to running that again in 22-23, and again the IRA service will look to support that as much as possible, because obviously it's really important that all of our services for children in care are shaped by what those children experience and what they tell us. So you'll see in the report that a huge part of the IRA role is obviously ensuring that children's needs are being met, that there's no drift and delay in their care planning, that the corporate parents and the statutory responsibilities to those children are being met. So a number of escalations, both formally and informally, were made. I would say, speaking to colleagues in other southwest regions, the biggest challenge is how easy it is to sometimes capture all of those, because sometimes they're just day-to-day conversations. So when I talk about some of the data in this report, that's about ones that have solely kind of reached a point where the IRO's kind of told me, I'm worried about these children, or I've had to have a discussion about this particular area of their care planning. So last year we had approximately 75 informal escalations, and this year it's actually declined to 39, which is quite, I think, a significant decline. So talking to the IROs within my service about that, I think it's because we're trying desperately to find resolution at the kind of earliest point possible, and having that as part of a conversation, and colleagues in children's social care and other services are really receptive to the views of IROs and do take that on board. So IROs haven't felt the need to kind of formally come to me to say, I've raised this challenge, or I'm concerned about this child. So the good thing is that I would say all of the formal escalations that are made by an IRO have all been upheld and heard by our colleagues in children's social care, and changes have been made. So I think that shows you the value of the IRO service in terms of that scrutiny and that quality assurance and making sure plans for children are in their best interests. And what going forward, my intention is to then start looking at kind of themes periodically across perhaps year on year, kind of looking at do we have particular themes around some of those escalations, and then kind of what some of that learning might be to kind of prevent that in the future. I think also, and I haven't commented upon it in the report, but something in preparation for today was that within children's services we're seeing a real challenge in terms of social work, social workers being brought into the profession. Those working in safeguarding, it's really challenging. So we probably are seeing a real increase in the number of newly qualified social workers. So what you need is a really good kind of IRO service who can be that kind of support, that guidance, that can offer that challenge, because IRAs have got management experience, they've got care planning experience, they've worked in adoption, some of them have worked in Ofsted. There's a wealth of experience that they can kind of draw upon and share with social workers. So it's another safety valve, I think, for our children in care, that we've got an IRA service that can offer that to a demographic that's kind of growing in terms of its expertise. One of the areas that I'm also looking at going forwards is developing a quality assurance framework specific for my service area, to look at how some of the themes that we identify for our children in care can be greater reported upon. So working with colleagues in children's social care to look at that reporting framework and scrutiny of some of the issues in the areas that we identify throughout the year, rather than kind of sometimes at key junctures like annual reporting or quarterly reporting. So I'm incredibly proud of our IRO service, and I think it's a real credit to Baines that we've got 6 really committed IROs who've been on a real journey over the last 3 years in terms of capacity, demand, COVID, increase in children coming into care, the placement of those children being really at times a challenge to get to, but they've really committed to those children and they know them incredibly well. If they were sat here today, you would be absolutely amazed at how well they know their children, which I often find incredible because they're not seeing them on a day-to-day basis, but they really hold them in mind. So I think, there are definitely some areas of performance that we need to keep an eye on, but I think overall they are a service that are really strong and robust in making sure the needs of our children are most vulnerable are considered.
Okay, thank you, Sarah. Michelle.
Thank you for your report, Sarah. It's very detailed as ever, and I can really see the challenges that you face in keeping everything going, so thank you. I just wanted to ask a question about the out of area children who are placed out of area, and specifically thinking about asylum children seeking asylum, about kind of how that works in terms of monitoring them if they're placed out of area, and what the reasons for them being placed out of area might be. But just thinking about how that works for you, you said in your presentation that IROs physically go and visit them, and that must make it a nightmare. So
So obviously in Bath and North East Somerset, our unaccompanied asylum seeking children figures over the kind of last 3 years have normally been on average around 5 or 6 children a year, and so you'll see in this year we've had for us that's a significant increase in terms of cohort, and actually the Q1 and Q2, if I envisage being sat here next year telling you a very different figure for unaccompanied asylum seeking children as most local authorities. So under the National Transfer Scheme, when a local authority is notified that children are being placed in their care, sometimes those children are already in foster care. So they might be in Croydon, they might be in Birmingham, in London, and then there's always this kind of, consideration needs to be given about actually the disruption of moving that young person again. What we hear from children from overseas is that they often have kind of met people on their journey here, and that they're kind of in that same vicinity, and so they want to stay in those communities. And one of the conversations that I think IRAs and I often have is we have children who essentially are our children in Bath and North East Somerset who've never stepped foot in Bath and North East Somerset. They don't know what it looks like, they don't know kind of what it would feel like to be here, what services they could access, but they have a really strong voice that they want to be where they are, and sadly there has been times where young people have felt the only way that they can kind of really, in extreme situations, express themselves is by going on hunger strike or refusing to stay in their placement if there was fear of kind of being moved. So I think it's always a really delicate situation. So the IRO and the social worker would work really closely together to kind of think about, is, first of all, this the right placement? Because they're not always the right placements, and if they're not, then we will find somewhere else. We will work with social care to think about what do those children need. The social workers, I mean, IRAs visit them, but social workers visit those children every 6 weeks, which is a huge commitment and you know, a huge, you know, they're really valued visits, and they still go, and often there needs to be interpreters. We have some children in our care where there is no written language from where they come from, so communicating with those children is really difficult. So in terms of placement location, there's always consideration about where they're placed. I think the challenge is that there are no, you know, placements aren't becoming available all the time, and we are constantly going to have a real challenge, particularly in our area where, I suppose, in terms of diversity, we're not as diverse as some of our inner cities, so London, Manchester, Birmingham, Croydon, and a lot of young people want to be in those areas, and that's where they want to stay. So, you know, some care leavers now who actually have had the same IRA for 7 years, as adults have contacted them when their siblings come from overseas, and there's been dispute that another local authority have said their siblings over 18, but actually this sibling, you know, been telling us when they're a child that I have a younger sibling at home. And so, you know, the IRA was able to help that child navigate what's a really complex situation in terms of age assessments. So I think what I would hope is that no child would feel that their service, what they were receiving as a child in care, is any different, that they're not placed in the care of Bath and North East Somerset. But there is a real kind of tension there about how can our children never have set foot in an area where they actually are, you know, we're their corporate parents, we're responsible for them. So yeah, I don't think
interrupt
there's
you
an
then,
answer.
Sarah, these children, they're refugee children, are they? And,
Yeah, unaccompanied or refugee, yeah.
This authority volunteers to take responsibility for them.
Well, I don't know that we volunteer. I think often we're told we have to take them now. I think volunteers probably...
That's been nice with my words.
Yeah, but yeah, so they're placed in our care. They are the responsibility of Bath and North East Somerset, so we are seen as their parents.
So it's an ad hoc arrangement. We could get whoever.
Yeah, so last year the National Transfer Scheme agreed a certain percentage of children, the entire cohort of children, that local authority would get a percentage of those children would have to be children from unaccompanied asylum-seeking, refugee, trafficked children. And then because of the growing number of children coming into the UK, that percentage has to increase, which is putting huge pressures not just on this local authority and all local authorities, and trying to find placements. So, you know, you will have seen kind of in the media kind of reports about children and adults being in kind of, you know, holding places which are just not suitable, but trying to find placements is a real challenge. So I'm really committed as an IRO service. I think we feel really confident that Children's Social Care actively look to find suitable placements and get those children into those as soon as possible. But there's no prediction. You could get 5 children coming this week, none next week, then, you know. So in quarter 1 and 2 of 22-23, we've had 16 unaccompanied asylum-seeking children placed in the care of Bath and North East Somerset, and that's alongside the children from our communities where there are welfare and safeguarding concerns.
So this increases the workload of a limited number of IROs.
Absolutely, and so in kind of 2016-2017, our child in care figures were about 116 children in care, and now, as of the end of last week, we're on 214 children in care. And so for our IRO service, that is a significant increase, but actually you only need about 30 to 40 extra children in care for a small IRO service such as this for everybody to reach capacity.
Liz.
Thank you very much, Sarah. I'm so pleased you ended on a very positive note because I sensed, and obviously from the report, it was your frustration at not being able to deliver what you want to deliver and what your IROs want to deliver. And my questions, I think you've had them, but they're all about what can we do about this, and what about capacity? And I think you've touched on it a little bit. In fact, we're having difficulties in meeting statutory requirements if the number of children in care continues to rise. I hadn't realised it. Now it's now over the 200 mark. So if you're not doing it now, what's going to happen? I hope Dina, I think, is listening to this. Because this is something that needs to be pushed within the budget, that the capacity needs to increase. And I said about the timeliness of reviews, because obviously it is worrying, but again, it's a capacity issue. And you've mentioned about the unaccompanied asylum seekers. I would like to say, by the way, that we, per head of population, were not very high in taking in refugees and asylum seekers. So I just wanted to say that it is a burden when, unfortunately, that fortunately we are looking after them, but it is a big burden on a local authority like ours to have, and other local authorities, especially Kent, to have to, look after them. But that's the human rights issue. But anyway, aside of that, it looks like they are going to continue to grow, and we're going to get a greater percentage. And I know there's a discussion about, do they really feel part of BAMES, which they don't. But, as part of the national picture, we have to do our bit. But how are we going to cope again? And I'm speaking, all my questions are, your IROs are doing a great job. You presented a really positive picture of these people who are working for us as a council, who are doing a fantastic job. But they're doing this job, almost without any kind of job satisfaction, and that they're working against the situations that we are in because they don't have the capacity to meet the requirements that they're supposed to be meeting.
So first of all, I say they definitely have job satisfaction, but at times it may waver a little. The outcomes that they want for children is kind of what drives them to do the role that they do. In terms of our growing numbers of children in care, we can't sit here and say it's just because of our unaccompanied asylum-seeking children. We have seen, challenges that our communities have faced, particularly as a result of COVID, and, the needs of children. Just listening to the radio this morning about our 5-year-olds that are at school who've not had opportunities to socialise, and speech and language development kind of being impaired, and we know that kind of later on in life, kind of the impact that has on emotional, behavioural kind of relationships, etc. So we're not just seeing an increase in children because of our US numbers. It is also because of safeguarding and children needing to be safe and unfortunately not being able to remain with their family. I think in terms of contingency, it would be wrong of me to sit here and say we have a really clearly defined contingency plan. We don't, but what we do have is a commitment from our Director of Education and Safeguarding and from our Director of Children's Social Care to work with services to kind of think about the growing needs of those services and to look at how we can deliver services in a way that continues to meet the needs of those children and keep them on the forefront of everybody's mind. Last week there was a letter around kind of local authorities and the pressures faced with US children and thinking about how services might be able to be provided to those children, perhaps not always with necessarily a qualified social worker, but perhaps a more inexperienced, like a family support practitioner, but as long as there was good kind of social work qualified oversight for those children. That's not a path we've gone down in Bath and North East Somerset, so I don't want anyone to think that is, but I'm just saying that I think nationally we're going to have to start thinking about what do we do. I can't resolve it on my own in my service, so we have to work collectively with colleagues across children's services as a whole to look at how we continue to meet our statutory needs, but most importantly that our children feel held and they understand what's happening for them and they understand what their plans are and that those plans are progressing. So it's definitely a conversation that started. It's a conversation that will have to continue, and that there has been investment in our service to try and strengthen it, but the numbers I think is the issue, is that we didn't know whether it was a spike because of COVID that we saw suddenly this increase, or whether actually this is now kind of our new demographic, and I think that's what we're trying to navigate our way through.
You present a formidable challenge. And there are no more speakers, so but we've got recommendations here that recognise the challenges that there are on the service. So is the panel prepared to accept those as presented? Right. And thank you very much. And thank you, Sarah.
Thank you.
Until we meet the next time. No doubt. Thank you. So we move on to item 13, and the Director of Children's Services and Education 6-month update. Mary.
Thank you very much, Chair. I guess my summary report gives an overview, and I guess there's a bit of a pattern in terms of the updates that the panel will have received today, is that there is increasing demand, that there is increasing complexity, and Sarah very eloquently gave an overview in terms of the IRO service. And what I've tried to capture in a summary report is that while all of the teams in the services are stretched, they continue to work incredibly hard to really effectively discharge all the statutory functions of the local authority. But the services are under pressure. I can go through each of the individual ones, but if I may, I'll just identify a few. We've given an update in terms of the virtual school. Again, you know, in terms of our unaccompanied asylum-seeking children, we've got pressures within that service in terms of responding. But again, we've included some of the academic data, which is really positive. So actually for our children who are supported through the virtual school, in addition to our most complex children in terms of SEND and those children who are on child protection and CHIN plans, they've been incredibly well supported in terms of those extended duties. We don't know yet until September whether that will continue, because that was year-on-year extension, but it's been really, really positive. Chris has spoken earlier in terms of the work of the School Standards Board, and we've got a meeting next week, again looking at our safety valve programme, looking at the poverty proofing work that our colleagues in public health have been doing, which has been really, really positive in supporting our schools. And again, looking at education performance. St John's we've touched on, and we can come back at a future point, but there's detail there. We've detailed the challenges within children's services. We have got some specific challenges within our safeguarding outcomes part of the service. That's the part of the service that recruitment and retention has been most challenged. What I would say, however, is those colleagues who've left that service have been primarily maintained within the council. So some have moved into the independent reviewing service, some have moved into our family placement team, and some into our children in care team. So while they've left that part of the service, they've remained within the wider service, which is really, really positive. We are working very closely with our colleagues in HR. There is a recruitment consultant who has come in. We're also looking at using other agencies that we've not used historically, again about attracting colleagues into those posts. We're not on our own. The challenges around our recruitment and retention are regional and national. We're working with our colleagues across ADCS and with the DFE around what more we can do. But I do need to say, you know, at this point in time, we have some challenges that we're working our way through in terms of our capacity. But no issue at all in terms of our colleagues' commitment, their flexibility and agility in terms of what they've responded since well before the pandemic. I won't go into the update on early help if I can. It's there. It gives a good bit of information. We've included quite a bit around our children in care leavers. We had a really excellent care leavers event last week that Dina also talked about, and various colleagues were there to acknowledge the exhibition that's going to go on tour, but it was really, really positive and a wonderful celebration of our young people and our care experience and what they can contribute to our community. Panel members will recall that we had Mark Riddell visit us back in 2018 to look at our care leaver offer and made some recommendations back then. He returned in October. We think we had everything happening in October across children's services, and actually was really pleased with the progress that we've made in terms of our care leaver offer. But of course, in that period, our care leaver offer is now extended up to 25 from 21. So historically, our duty was up to 21. That goes up to 25 as of this year. So a lot in place, more to do, I would say. Foster care recruitment and retention and celebration. Sarah mentioned the challenges we've got around sufficiency and local placements. I'm really pleased to say that our foster care recruitment has been outstanding in terms of the numbers of new foster carers and the numbers of supported lodgings we've attracted through the marketing campaign. We need more, and we continue to do our best to recruit more foster carers. Equally, we had a really positive celebration event for our foster carers in October. We've not managed to have a celebration event for foster carers since before the pandemic, and our foster carers have been marvellous all the way through the pandemic and continue to deliver really, really excellent services for our children and families. I've just mentioned the extended duties. There's quite a bit in this paper around the care experience team. We do need more capacity in some of our teams, and we are certainly, through our medium-term finance plan, we are putting in some requests for demographic growth to meet some of the challenges in some of those teams that we are hopeful that will be supported through the budget process, that Dina has supported us through in terms of putting those forward. The last two sections is around youth justice, and a really important development is our youth offending service is moving and changing its name to the Youth Justice Service, which is more in keeping with what other areas have moved to over the years, which is very much about getting justice for the child and for the person who has been affected by the criminal activity. That's going to work its way through the various systems over the next couple of months. But I think in terms of, from a youth justice perspective, recognising a child-first approach is really important for us across our youth justice system. And then finally, I do want to pick up a little bit in terms of the work of the Violence Reduction Unit, and we know that we have had some challenges in our communities the last couple of months. But again, to indicate that there has been increased funding that's come down through the Office of Police and Crime Commissioner. We now have funding guaranteed for 3 years, which is really good, because historically we only got year on year. And some of that funding will be looked at the detached youth work that's currently provided by Youth Connect Southwest, and again some longer term mentoring support for young people. Happy to pick up on any questions. It's a general summary of the efforts that everybody across the service is undertaking to ensure that we deliver good outcomes for all of our children, families and communities, but a recognition of the challenges that we're currently experiencing. And I guess it would be remiss of me not to say that we are still seeing the impact of the pandemic in terms of our children, families and communities. And while some cohorts of the society have moved on, our families have not yet moved out beyond the impact in terms of children's learning, their development, their socialisation and their mental health.
Thank you, Mary. Michelle.
Thank you, Mary. I mean, obviously a common theme, as you pointed out, throughout Sarah's report and your report, is that the pressure on services, and I worry about that because while those services are, currently running as they should be, that's not a sustainable thing. And so my question is kind of, first of all, are we confident that the staff delivering those services are well supported? And secondly, what can we do as councillors? What can we do to help?
So I think staff are very well supported. We have been incredibly fortunate that all of our heads of service, all of our managers, our deputy team managers, our senior practitioners have not changed. So we've retained a really stable workforce, and I think colleagues have worked incredibly hard to support, and we've been very well supported by Dina and by our leader and by our chief exec. So I think that has been really positive. I do think we are seeing the impact in terms of demand and complexity, where we would welcome some additional capacity and support around our workforce moving forward.
Thank you. Liz?
Well, I think Dina must have red ears at this stage, because I think we're all saying we need to make sure that our services are supported and they have the capacity. And I know you're nodding, Dina. But I did want to ask Mary, you did say the safeguarding, the social workers who had special responsibility for safeguarding, that they had moved elsewhere. But have you been able to recruit, because nationally there's a problem, have you been able to recruit safeguarding social workers?
Thank you. So for the first time in a long time, we have got quite a number of agency staff within the safeguarding outcomes. So we're meeting all of our responsibilities. But two things we are looking, and we've got high quality agency staff currently who are in those teams. So we are meeting all of our responsibilities. But two things we are looking to do is whether we could develop a retention policy or a retention rate for that part of the service, so that, because it is some of the most challenging work that any social worker will do, which is dealing with that frontline child protection. So we are looking at what's the additional funding or the additional payment that we could put in for those frontline to help with that retention. And then secondly, as I said, we are working very closely with a HR consultant and different agencies to try and track some more staff in. We've spoken to those staff who are working through agency, and some of them have made a choice currently in terms of their lifestyle or their flexibility. And of course, as an employer, Baines is incredibly flexible, so we're always looking, well, what would it take for you to join us and stay with us, as opposed to being agency. So we do exhaust all of those opportunities.
Thank you. They are, of course, more expensive, that's the thing. Like teachers, supply teachers. The other thing, we've talked about extended duties for care leaves, and you've mentioned that, and obviously it's a capacity issue again. But I wanted to pick it up here from the IRO report, that there were 39 informal escalations, but I hadn't realised it's down from 75, so obviously good things are happening here. There were some just individual cases, and we can see that individual things happen. And I was wondering, were you aware of these, and what were you doing to make sure they don't happen in future?
So historically, under the care planning regulations, which is the regulations under which the IRO service operates, so their responsibility is to ensure that the care plan that the local authority has got for the child is that we're executing it as best we can. So they very much hold that mirror to us in terms of our practice. And going back a number of years ago, we didn't have an escalation policy. We didn't have those formal arrangements. So we set those up so that we would formally capture any concerns about meeting or delivery against the plan. So as DCS, I absolutely welcome that we've created an environment and a way of working that the IRO service will address those as informally as possible, but that they are recorded as an escalation in all cases. And it's one of those areas that when Ofsted come to visit, they want to see evidence that the IRO service, where they see any delays, could be a delay about a visit, could be a delay about some action, that they are formally escalating, formally recording. And across the service, Sarah meets with the heads of service and children's social care on a quarterly basis to review those practice and what some of those concerns would be. So it is assuring to me the numbers have reduced, but equally, I would want the numbers to be high if there were concerns about the practice. So yes, I am aware of all of those, Liz. Thank you.
Kevin?
Just one quick one, which excuse me, relates back to March, when you very kindly said about the data accelerator bid for the Avon and Somerset Police have got, and just wondered, has Operation Encompass now been fully implemented with that?
They're fully committed to implementing it, but they've not given me a date yet in terms of when that's going to happen, but they have absolutely committed to implementing it across Bath and North East Somerset. I don't have a date, Kevin, in terms of when that's actually going to be. I can go back to my police colleagues and ask for the date, which I'll happily do.
Any more questions from the panel? No? So Mary, you've presented an inventory of a series of challenges again. It's good that you're exploring the possible recruiting drive of trying to transfer agency staff through to full-time employees. It has to be recognised the highly positive Ofsted report, which is to be congratulated, and I'll go as far as also to congratulate Dina in her commitment, her continuing commitment to supporting the service. So all round, very, very good, but against considerable challenges, it has to be recognised. So I think we can do no more at the moment but note the report. So thank you very much, thank you. So moving on then to item 12. No, sorry, that's the time.
Not the time, Vic, it's gone past.
Yes, I'm fully aware. No, so we're going on to the an unregistered number at the panel work plan. So you've got that at the end of the report. Are there any considerations that you'd like to put forward? And again, it's against the pressures of everything else that we have. It's dividing loyalties, I'm afraid, when you set the agenda. But if you have anything pressing, other than that, you leave it to the officers, Michelle and myself, to consider what the agenda content will be next time round. I see a wall of silence, so we'll take it at that. So I'll now bring the meeting to a close, only 25 minutes over schedule, so something of a record from me.
You did well.
All right, 20, so I stand corrected. So that's a record from me. I know Michelle's done extremely well in my absence, so thank you all very much. Thank you.
Thank you.